Thank you very much for joining us today. This is the 2023 Healthology Symposium, and our topic has been building a foundation of health through lifestyle behaviors. We're focusing on the interdisciplinary health sciences department, and specifically, we're including and involving nutrition, physical activity, and social support. I'd now like to welcome Dr. Amanda Lynch up to the podium, and Amanda will introduce our keynote speaker.
So now I'd like to introduce our next and final guest speaker, Dr. Kim Williams. He comes from us from the Department of Medicine at the University of Louisville. He brings with us over 40 years of experience as an educator, researcher, and clinician focused on advocacy for nutrition, national and international healthcare disparities, healthcare delivery, and advanced access to cardiac imaging. He's the founder of the Urban Cardiology Initiative in Detroit, aimed to reduce ethnic heart care disparities, and is the founding editor-in-chief of the International Journal of Disease Reversal and Prevention. As an internationally recognized speaker, Dr. Williams focuses on preventative cardiology and synthesizing data on cardiovascular risk and mortality due to nutrition. So we have literally begun and ended our program with nutrition. Please join me in welcoming Dr. Kim Williams.
Well, good evening, and thank you so much for the kind introduction and for the invitation. And it's a pleasure to be here. I always enjoy speaking before meals or during meals, so people can sort of modify what they're eating. So the title, I'm calling it Dueling the Dual Pandemic for reasons that we've had a pandemic of heart disease that's been going on since 1918. It was taken out for that 1 year by the Spanish flu. We thought COVID would take it out in 2020. It didn't make it. And so we really have been struggling. And it really brings out a lot of issues about the way we do our society, the way we live. And we're going to talk about predominantly the issues of lifestyle and nutrition. Okay, there you have it. So this is all you really need to know. The whole lecture is all boiled down to this one slide. And that is that food really is the source of almost all of our illnesses. It underpins a lot of the, other than tobacco, underpins a lot of the risk factors that we have, and it is our number one risk. And our food choices really make a difference. We really struggle in this country with the number of people who have food-related illnesses. And we're talking about metabolic syndrome. That's where you're overweight or obese and your insulin levels get high and you become insulin resistant, blood sugar, blood pressure, cholesterol. And we're really gonna focus on each of those things. Our teenagers are overweight and obese, and that affects everything from military readiness to future healthcare costs. And if we talk about the costs, they are really staggering. We're spending about 1/5 of our gross domestic product on healthcare. And if you look at the bottom, or next to last, 80% of the healthcare costs in this country are actually because of things that we eat. And we can do a lot better than this. We need to. So heart disease, I mentioned it was the number one killer of Americans. Well, it's no longer in the rest of the modernized world. There's only one high-income country on the planet still where heart disease is number one. It's number one in most underdeveloped countries, and that's the United States. And we have all the best technology, and we have the best education system, but we are somehow unable to extend that into good life expectancy compared to other advanced nations. So we were so proud of this in cardiology. I am a department chair now, sure, so I'm a recovering cardiologist, but we were so proud of this for so long until about 2015. That was the time that I got up in front. I was incoming president of the American College of Cardiology, got up in front of 5,000 people and said, I'm not retiring until we're number 2, because I knew the numbers were just gonna get there. No, instead they flattened out and then they started to increase. But I also want you to notice the black-white difference, because I'm going to talk a lot about ethnic disparities, probably more than you want to hear, because I think it's a critical issue for our nation and for anyone who thinks about health. So what happened after 2015, that plateau, is everything started going haywire. Even though we were so good at cardiology, and I participate in guidelines, write guidelines, try to get doctors to do better cardiology, we're saving lives left and right, and it's being outstripped by the number of people who are having heart attacks, who are having premature heart attacks, all because of dietary risk. And you could say that we were doing the wrong thing for all those 40 years of decreasing mortality, that we were actually mopping up the floor instead of turning off the faucet. That is, we got some amazing mops. We really do. The stents, the bypasses, the medications, we do amazing things in cardiology. But if we're not preventing the disease, it's going to catch us. And that's what's happened. And so here we are, a death every 36 seconds, and I'm going to go through all of it. But to look at that last bullet point, that over half of our African American population has some form of cardiovascular disease, this is a blight on our society that we can't afford. So then you put on top of that a fast pandemic, that is COVID-19, with its proclivity to make inflammation and to victimize people who had diabetes, obesity, existing blood vessel issues such as hypertension, and it increased mortality dramatically. And who fared the worst? Everybody knows this now, that people of color fared the worst in terms of mortality from all sorts of things, but particularly COVID. And so what I'm hoping to convince you of is that if you're not doing a plant-based diet just yet, no guilt, no holier than thou, but it's critical for our society, it's critical for our planet, and it's absolutely critical for everyone around you to know that you are concerned about healthcare enough to do this for our country. So I'm going to show you what I think are pretty famous slides now about health equity. Has everybody seen this before? Okay, the difference between equality and equity. What you may not have seen is this variation of the slide. Yeah. That's what we tend to do in our society. The rich get richer, poor get poorer, and we really have to actively intervene to stop this kind of thing from happening. Okay, but I got a different one for you that you may not have seen. And that is, instead of equity, reality, or equality, how about removing the barrier? If you remove the barrier, everyone can see the game without any problem because the cause of the inequity was removed. Okay, so if you'll tolerate it, I'm going to do a quiz. Who can tell me what this is? Smallpox, absolutely. Okay, and I'm showing why is this guy showing you smallpox? Because it was a huge black-white disparity, and they're living in close proximity, spreading the disease. It was one of the first ones. So what I'm really telling you is that this is something that's been going on for centuries. So this is really a lot of 18th century stuff. There was a declining incidence. Why? Because there was an intervention. What was that intervention? That stopped blacks and whites? It was inoculation, okay? And it turns out that it helped pretty much everybody. It was started by an African-American slave, okay? And he had some history of seeing it in West Africa before he was brought over here as a child, and he started taking the pustules and injecting them into people, and not everybody survived that. Some of them actually got smallpox, but many, many did, okay? Saved a lot of lives simply by getting the disease to go away, okay? All right, more fans of history. Any idea what this is? I won't. Two pictures. You see a lot of African-looking faces. That's Panama, the Panama Canal. It was a huge ethnic disparity because the French were trying to dig it, and they didn't understand why people were dying. What were they dying from? What? It was yellow fever. And so another absolutely huge black-white disparity, but this wasn't social or anything other than the fact that slavery was pretty much over in the Western Hemisphere in the late 1800s, and people were coming from the Caribbean to try and make money from the French to help dig that canal and feed their families. And when yellow fever broke out, it affected blacks much more because that's who was there. Well, some very smart people, after the French gave up in disgust, 10 years later, the United States went in there and they did the right thing. Walter Reed, folks, figured it out that it was the mosquito. And they actually did a tremendous job of getting rid of a disease and get rid of the black-white disparity. Okay, now everybody knows who this is, right? Okay. And what disease did he have? Polio, absolutely. And so now we're getting to where people remember, because when I was growing up as a kid, it was still a big deal in my community in the south side of Chicago. It had been pretty much eliminated in most places, but we had this huge racial difference. You had President Roosevelt setting up areas of treatment for whites that blacks couldn't get into. And yet blacks were having it in large numbers. Okay, so why did I take the last 4.5 minutes and go through that? Because what I wanted you to understand is that this whole thing of people of color having the raw end of a pandemic or of disease is not new. And so whether you're talking about COVID or you're talking about heart disease, the answer really is the same. Justice, remove the barrier, remove the disease. And we didn't fix all of the racism, but if we look at those black-white differences, which was published in New England Journal of Medicine in COVID, where 77% of the folks who were dying were black, well, it turns out that black race, if you do a statistical adjustment, black race was not associated with more mortality. It was the fact that the blacks had more obesity, the blacks had more hypertension, had social disparities that were driving the mortality. So we have opportunities to make an intervention and make our society better, but I'm gonna tell you that it starts with nutrition. Okay, where are we? This was the reason that it took them a couple extra time to put the slides in, is because these are new slides. This was just published. This is, if I go back here, this is state level cardiovascular mortality, and I want you to look at Michigan. So I had to put this in. Michigan is one of the worst states, one of the darkest colors for cardiovascular mortality for who? African American men, okay? And so what are we gonna do about it? This might be a little hard to see, but what they were doing was 4-decade trends and showing that the decreases were better for pretty much everybody else than African American men. What is going to happen? So that's where we are now. What is going to happen? That was published a couple months ago by Jim Januzzi in the Journal of American College of Cardiology. And it's startling. So he took census data from 2020 and made a projection. This was the famous central illustration at JACC. I can't read that, so I did another slide for you, okay? And so, and this is what it showed. They're expecting that by 2060 versus 2025, there's gonna be significantly more diabetes, hypertension, high cholesterol, and obesity. And that is going to have its consequences in terms of ischemic heart disease, that's heart attacks, heart failure, and the like. And so the startling part is that expected to be decreasing in the majority population and increasing in racial minorities, Hispanic and blacks. And so what are we gonna do about it? You can look at these graphs, and I'm saying this is an opportunity. This is a moral imperative that we really need to intervene now. And because projections are only real if we let them happen. Okay, so these future risks can be nipped in the bud by dietary justice. Let's do the right thing in terms of making people focus on health. What are we doing now? Not so well. I mean, so we've been putting out guidelines for a while. The United States Dietary Guidelines says 2 to 3 cups of vegetables per day. And how many people do it? About 10%. Okay, most people do not do it. How does it, and what does the food that we eat, how it is affecting us? This is our map of self-reported obesity. If you look at the greater than 35%, that's the really dark area. It's a handful of states, except if you look at the white population, it's about half that. If you look at the Hispanic population, that doubles it. And if you look at the African American population, it's pretty much every state that has more than 35% of the people being obese. It's what we do. It's fast food. It's larger sizes. We are now changing the lingo, diabesity, thinking about the triple whammy. And this was from Cardiology Magazine last week, where you're looking at diabetes, obesity, and sleep disordered breathing. They are all coming together. And so I don't want to, this is actually from yesterday that this one was published, so I had to stick it in here. It's not just us, it's not just blacks. This is actually happening worldwide. After COVID, the body mass index of the World Obesity Atlas, is off the charts compared to the way it was before. But it's all centering around food. Now, there are good food patterns and there are bad food patterns, and I want to show you what spend most of the time talking about that. So this is a slide from the Regards trial. It's from University of Alabama, Birmingham, and they're showing, in that red area, that's the Southern diet. That's what we call, excuse me, that's what we would call soul food, taking an animal product and deep frying it, taking vegetables and putting meat in them, sweet tea instead of tea. Yams are great, candied yams, not so great. And so that dietary eating pattern has its consequences in terms of kidney disease, cerebrovascular disease, and cardiac disease. And so one of the issues that I've been trying to tackle with about zero success, I might add, except being able to show you this slide, is the marketing of food. So one of my co-investigators and my granddaughter, Kari, sat around and watched television, and they recorded what they saw. And then we graded it based on, some of you were at the previous lecture, that Satija article that talked about healthy versus unhealthy plant-based food. That had a scoring system that you saw if you were there. Well, we used that scoring system to score the commercials, and they were terrible. What you basically saw is that most of the television commercials were about fast food, and they were showing on average 3 things that people should never eat. Refined grains such as saturated fat, animal protein, and the like. Did a little bit better with individual items, a little bit better with grocery stores and home food delivery, but all of the scores were negative. They were all showing something that people should not be eating. And so we actually concluded that we should change the television commercials. We did that in 1973 for cigarettes. No one, you have to be my age or older to remember a cigarette commercial. Well, it turns out that no one is listening to this, okay, for obvious reasons. It's big business, but we put it out there, and maybe somebody will do it. Why? Because it's a socioeconomic disparity. It turns out, drum roll, poor people watch more television, okay? And the odds of a person who makes $100,000 a year or more watching massive amounts of television is almost zero. But poor people watch a lot of television all the time. And so they're getting inundated with unhealthy food as part of what they do. So people talk about, now this is another social issue, people talk about the distribution of healthy food. We have food deserts. When I got to Louisville, they were calling it a food apartheid. I live on the east side, but the West End has really poor food. And then people were calling it a food swamp. We shouldn't do that. Swamps are actually good for the planet. But look at that. This is really my take on it. That the food deserts instead of food deserts. People are actually eating what they're comfortable with, and what's marketed to them. And the stores are not in the healthcare business. They're in the don't lose your store business. And they will sell what people buy. So if people are going in and buying Hostess Twinkies, that's on us. We have to do the kind of education. So that was one recommendation to the White House Conference on Food, Health, and Nutrition in the fall that they did take. And I hope that they really follow through on education and food labeling in stores, red, yellow, and green. It's been done in other countries. It does work. And one of the things that he said that he would do that I suggested was change the food subsidies. Who knew that we're spending billions of dollars making unhealthy things less costly? And that Hostess Twinkie I showed you has 14 different compounds in it that are subsidized by our government. So this is something that we should take on, and the administration said he's going to do it. I hope they were very serious. This is hot off the press because I just got word while I was out there that it was accepted with revisions. So I've never shown something accepted with revisions before, but here it is. Sickening servings. This is another thing that we do. This is an analysis of vegan food that me and my co-investigators, 162 restaurants in 7 countries, everywhere where there's a medical meeting or a tennis tournament. I went there looking at Happy Cow, which is the app, and the question is, how healthy is the stuff? So we gave everybody 10 points to start off, 10 points for 10 entrees, and then graded them off if something was fried, if it had refined grains, that is, the white bread, white rice, or saturated fat, like Beyond Meat, or Impossible Burger, or coconut milk. Well, the news was not good. If you were a vegan restaurant shown in green, the mode was actually 7, but the mean was actually a little higher than if you were a omnivore restaurant that had vegan options. But you could find food that was healthy. It's just it was very difficult. The majority, the average, was 4.2, meaning that if you add up all your best scores in your average restaurant, you're going to have 4 items that you could choose from. And the problem is, how many people ordering this food know whether or not the food is damaging? And so, again, we have to point toward education. All right, so I'm going to spend the rest of the time talking about these 4 risk factors, diabetes, obesity, hypertension, and hyperlipidemia, and I got some surprises for you. This is not a surprise. You do a whole food plant-based diet, your obesity gets better. So the Ornish diet's been out there for a long time. You could lose weight on other diets, but are they sustained? That's one question. And are they safe, like the Atkins diet? We'll talk about that one in a bit. How about blood pressure? You do massive amount of information saying that the first move, including our 2017 hypertension guidelines as a co-author, the first move is not a drug. It's actually food as medicine, whole food plant-based diet and exercise. And then if the blood pressure is way too high, yes, you do start drugs, but lifestyle intervention first. And this is the data to back that up. Every time you take an omnivore and make them some sort of vegan, the blood pressure goes down. That was really shown well in the DASH diet because they were able to trifurcate how well people were doing this low sodium DASH diet. And it turns out that those that were pretty much vegetarian, low fat, low cholesterol, they had the lowest blood pressures on intervention. How about cholesterol? You may have even heard this. So many people did. It doesn't matter what you eat, it's just your genes. It's completely not true. Multiple studies showing that if you do an intervention on an omnivore, you will see a dramatic drop in cholesterol. It's very convincing. You drop your ingested cholesterol and it'll go down. The one that I always show because it affected me personally, it's so funny, your other speaker that was earlier said she's vegan since 2003. Yeah, so anyway, that was when this came out. That was when I went vegan. It was because my LDL cholesterol was high, and you could see a dramatic drop with either the statin or with a whole food plant-based diet. But what's also on this slide is the decrease in inflammation, and that's really important. It's equally important to the LDL cholesterol. They both need to be reduced to get the best results. And when you're eating animal products, I did hear somebody say, I'm still eating fish, still eating chicken. When you eat animal products, you will not decrease your inflammation levels. You can, lower your cancer rates by changing from red meat, and stroke. I'll show you that data. But you're not going to lower the inflammation. That's a whole food plant-based diet. Okay. So this is Benita Shaw's work showing that a vegan diet, as opposed to the old AHA diet, I would say the new AHA diet is the guidelines they signed off that I wrote, which is pretty much vegan. And you will see a decrease in C-reactive protein, that measure of inflammation in the bloodstream. Okay, so what is underpinning those 4 things, cholesterol, diabetes, hypertension, and obesity? Well, I got a little bit of news for you. I know you're human, but the person next to you, maybe not so much, okay? So as it turns out, It's about the microbiome. About 43% of your total body cells are actually human. The rest are microorganisms. And if you did it by DNA pairs, you're like 1.1% human. They really outnumber us in the body, okay? And what are they doing? What are all these bacteria doing? Well, different organs, different places, sinusitis, you have a lot of different germs doing different things. But in the GI tract, where people are eating and then metabolizing food, it controls everything. Drug metabolism, inflammatory diseases, your response to COVID, which I'm going to show you in a bit, and how well you digest your food. It would be disrespectful to the microbiome literature to not mention neurology. I know this is a cardiac talk, but gosh, Alzheimer's disease, Parkinson's disease, multiple sclerosis. If you know anyone with these diseases, tell them that they need to do a whole food plant-based diet, change their microbiome, and they will get better. There's lots of literature. It's not just Vegan Propaganda Journal 101, which I edit, by the way. Okay, so you've heard a lot about probiotics. We're still looking for the probiotics that actually have some great outcomes, but the prebiotic, that is changing to a whole food plant-based diet, works really well, as does fecal transplant of healthy bacteria into someone, probably not to discuss over dinner, but the microbiome data and these four things that I wanted to talk about is so incredibly insightful. Let's start with hypertension. Loads of literature that this all has to do with which bacteria are in your GI tract. If you're in red, that's Klebsiella, Parabacteroides, you will have more inflammation, more higher vascular resistance, and your blood pressure goes up. And you have the ones where you have the more gram-positives and alpha diversity, those drive your blood pressure down. Hyperlipidemia. Who here has heard, I'm quizzing you a lot, who here has heard of caprostanol? I certainly had not. And the reason you haven't heard of it is because it doesn't do anything. Suppose you had bacteria in your GI tract that would take all your cholesterol and change it to caprostanol. That's what happens when you have a whole food plant-based diet. And so that metabolism from the bacteria is either going to be there because you have good bacteria or not. And so you can lower, now you can use statins, you can use ezetimibe, you can use all these drugs, but a whole food plant-based diet, not just decreasing the amount of cholesterol you're eating, which I thought that's what it was doing, but it turns out that it is changing your microbiome. For diabetes, it's hard to summarize it in a lecture without talking about 42 different studies, but suffice it to say, they have actually been able to map which microbes actually increase diabetes type 2 and which ones make it go away. It looks something like this. It looks really complicated, but it's actually not. If you look glucose insulin or inflammation or look at any parameter, there are bacteria in your GI tract that make it happen, they're in red, or make it not happen, and they're in blue. So you want to populate your GI tract with the bacteria that are going to make you healthy, okay? Obesity, same thing. Did you know that you could take the microbiome of a thin person, do a fecal transplant to an obese person, and they will lose weight? And you also could make the other person gain weight if you did it the opposite, because the obesity, how much you absorb the food, the way you metabolize the food, really does matter in terms of the bacteria in your GI tract. And so the fecal transplantation, these are things that hopefully will happen in the future in another piece in the armamentarium. But all you have to do is just change to a whole food plant-based diet and people will lose weight, not just because they're decreasing their calories, but because they change the microbiome. Okay, excuse me. So I'm going to mention a four-letter word. We're all adults here. Okay, it's TMAO. If you haven't heard of this, please write it down. You really want to know about TMAO. I'll give you a brief introduction. Trimethylamine N oxide is a compound. It was discovered and popularized at Cleveland Clinic. They actually have a serum blood test for it now. It started off 10 years ago, really cool. You eat the animal products up there. And you develop all the trimethylamine, which then goes to your liver, gets oxidized, TMAO, and that causes all kinds of cardiovascular havoc, heart attack, stroke, death, making plaques rupture, clotting on top of the plaques. It's now way more complicated than that. It now involves cerebrovascular disease and kidney disease. TMAO levels really drive a lot of the illnesses that we have. So now, if you don't remember anything else, it's the microbiome. inflammation, LDL, cholesterol, and TMAO. It turns out that you can change your TMAO level just by changing what you eat, of course. And so you can reduce it in a matter of weeks just by stopping eating particularly red meat. And white meat is better than red meat. No meat is better than any meat. That is, having plant-based protein options. And you heard that before, but some of you weren't at that previous lecture. That would be beans, grains, nuts, and seeds. Plant-based protein, good microbiome, low TMAO levels. Now, what does it do in terms of disease? There's the graph showing that the higher your blood test for TMAO is, the higher your heart attack, stroke, and death rate is. This is heart failure, one of the growing disease in the United States. And who dies of heart failure instead of living? It's people with the high TMAO levels. And so we're starting to understand a lot of the stuff that we've known for years, that red meat kills, processed red meat kills faster. It's not just cardiovascular, it is cancer mortality as well. That it's dose related, and that the biggest jump in those curves is between 0 and 1, so you probably should do 0. That it's particularly causing ischemic heart disease. That's the heart attacks, particularly in men because they eat too much. And processed red meat is twice as bad and I want you to remember that for some later slides. Processed red meat is twice as bad as regular red meat. I'm showing the multiple studies, all showing the same thing. That this study was actually trying to convince us that anything that you replace red meat with will improve your death rate. In this case, fish didn't work. It's not the only one to show that fish doesn't work, but the best thing would be soy, nuts, seeds, beans. So let's talk about heart failure for a minute, since it's growing so much. I mean, what thing do you know would increase heart failure, like 250% almost? Well, having a big heart attack or something like that, sure, but this is at a higher mortality if you have heart failure. And that's what happens when you're eating processed red meat. Well, it turns out that the Regards trial that I showed you earlier got into that. And what they showed is that if you do a plant-based diet, you get a 41% decrease in the risk of heart failure. And again, it's all because of the microbiome. And so the vegan-vegetarian microbiome has been studied. It actually tremendously improves overall health because the lowering of the risk factors that we've talked about. And so you actually have more dietary protein stuff that I need to mention. One is the egg thing, because it keeps coming up that people think eggs are healthy because that's what they're told, the incredible edible. Not so much. As it turns out, there's a linear relationship between egg consumption and mortality. And every half an egg that you eat increases your death rate. Now, interestingly enough, people said that doesn't count. It's American data. Well, this is actually from Italy. It didn't show a half an egg a day. It showed 4 per week. Wait a minute, that's a half an egg a day. Okay, so the data was essentially the same. And then it was published a third time from Asia, same idea, except they got a more linear relationship because they had a larger study. The more that you're eating the cholesterol in the egg, don't know about egg whites, but with real eggs, you are increasing your mortality dramatically. Well, it actually turns out that that applies to most animal protein. And so this is the Harvard data, looking at doctors and nurses with at least one risk factor. And this data is pretty compelling, that if you just replace 3% of your animal protein with vegetable protein, you get dramatic decreases in death, particularly a little bit for poultry and fish, more for dairy, more than red meat. Red meat is not as bad for you as eggs, and eggs are not nearly as bad for you as processed red meat. Okay, so this was criticized heavily, that people don't know how to do food frequency questionnaires, even though they're healthcare workers. They don't know what they're talking about. Well, it turns out this isn't a mistake. I didn't go backwards. This is the same title, same journal, 3 years later from the Japanese cohort, and it showed basically the same thing. There are no safe animal products if you're trying to avoid cardiovascular disease and overall mortality. Did it really get published a third time? Yeah, it did. A different database. This is the National Institute of Health and AARP Diet and Health Study, showing they did the same analysis, that is 3% change, what would happen to mortality, and you see these drops. But it wasn't just cardiovascular. or overall mortality. Every time you get rid of an animal product, this is red meat, this was eggs. Every time you get rid of an animal protein and replace it with vegetable protein, mortality drops. Okay, so you can look at it in the opposite way. Just what are people eating and how much do they die? And again, the ones that stick out are just consistent with all the data I've been showing you. Unprocessed red meat and eggs, and even dairy products actually increase mortality. And so you're getting a theme here that if we want to change our outcomes in this country, all we have to do is change the plant-based diet. And you will see the mortality go up as opposed to down. So along with that, I know there'll be the people who disagree with that because the keto diet became so famous. Why did keto diet get famous? Because it works. It does work. That is, if you eat only meat and fat, you will become ketotic and your blood sugar will go down, your insulin levels will go down, and you would think that the loss in weight would actually improve your risk. It does improve your blood pressure. And if you think diabetes and blood pressure going away, you would think people would do better. That's not what happens. And so unfortunately, if you do it with plants, shown in green, peanut butter, nuts, that sort of thing, yeah, it does go down. If you do it with animal products, it increases your mortality, 18%. But that 18% depends on how keto you are. So you can just stare at that for a moment. If you were really, really keto, we're talking about a 60% increase in mortality. Why? Same idea. It's the microbiome. It's inflammation and LDL cholesterol that way outweighs diabetes and hypertension. Who would have known that? And so people are feeling really good about doing the keto diet, and this is what's happening. So are there other safe, good dietary patterns? So how many people have heard that the Mediterranean diet is good for you and it's cardioprotective? Almost everybody's heard that. This was like newest News in the World report talking about Mediterranean diet. A total misunderstanding of the data. Please take a look. This was their famous publication 5 years ago. And what that famous graph where what you're seeing is the accumulation of events with the control diet at the top on the left, and 30% less if you did the Mediterranean diet. And that's fundamentally changing from red meat to fish and some poultry. And then there's two lines because they divided it into two groups, extra virgin olive oil and nuts, okay? And those lines were on top of each other, but a 30% decrease in heart attack, stroke, and death. So what's the problem? Why am I saying no Mediterranean diet? Because it wasn't heart attack, stroke, and death. That was a combined pre-specified endpoint, meaning that you say that's what you're going to analyze, you analyze that. But this table showed everyone that it only reduced stroke, changing from red meat to fish, changed the stroke rate dramatically. The cardiac death, that's the stroke. The heart attack rate was the same in all three groups. The cardiac death was the same in all three groups. And death from any cause was the same in all three groups. So Mediterranean diet, great if you want to prevent stroke, but if you want to live, let's not do that. Okay, now, the authors actually knew this when they analyzed the data, and they published something in an off journal because nobody was paying attention. And that is, how about a pro-vegetarian? This is the same data turned on its side, saying, we don't care what you were randomized to, nuts, meat, whatever. We don't care about that. We want to know how many vegetables did you eat? And they divided it into quintiles, and that's what it showed. A 42% decrease in mortality if you were essentially a vegetarian doing a Mediterranean diet. So that should be what people are trying to do. You know, the extra virgin olive oil, good for you, nuts, good for you, but eat plants. Okay. So we have lots of data to really defend that whole idea that the more plants you eat, the data is coming from everywhere in the scientific community, in the nutrition world, but it's really not penetrating, unfortunately. What can we do about it? keep talking about it. I'm going to show you a couple more things, and then I'm going to spend some time doing questions. One of the issues that is near to my heart, just because it affected people in my family, and this is part of being an African American. I have a handful of African Americans in the room, so I won't embarrass you by saying, does anybody in your family go on dialysis? We are 12% of the population, 35% of the dialysis patients, $100,000 a year from Medicare, because you automatically qualify for Medicare. So it's incredibly expensive, and if you put a dose of centuries of racism in there so that we have lower paying jobs, who's paying for our dialysis tax dollars? Not us. And so the fact of the matter is this is a blight on all of our society, and we can fix it. You're going to be shocked because your nephrology dietitians haven't told you this, but I'm hoping that they're going to read all this stuff and it's going to happen. We're going to change. Okay, so what am I talking about? Animal protein kills kidney cells. Simple as that. And plant protein actually preserves them. So if you have people with chronic kidney disease, the first thing you have to tell them is don't eat any more animal protein, and they will get better. Red meat is specifically driving people to dialysis, okay, in a dose-dependent fashion. And it is the microbiome, and guess what? The TMAO level. That's actually making it happen, affecting the kidneys, worsening long-term survival. Plant-based diets are now, again, not Vegan Journal 101. This is Nature Reviews Nephrology saying, put all your patients with chronic kidney disease on plant-based diet to avoid the metabolic complications. This is Renal Nutrition, saying exactly the same thing, but talking about all the risk factors and all the consequences of chronic disease, particularly on the heart. This is why a cardiologist is standing up here talking about it, because in our society, kidney disease patients don't die of kidney disease, they die of heart disease. Okay? Accelerated plaque and thickness of the heart and heart failure, all of that happens because of kidney disease. And so the National Kidney Foundation is trying to get the word out to turn every kidney disease patient vegan, and I'm hoping that they're successful because I'm just not seeing it yet. And it's really important to try to get this word out, and so I'm hoping that you'll all take this up. Okay, all right, I'm gonna switch topics back again to the COVID because there's important stuff that will sort of weave into the kinds of things that I've been talking about, and that is, it was all about the microbiome with COVID-19. It turns out we all should have had the guts to go vegan the moment we had this. And I only saw one person saying to clean up your diet, stop eating fried chicken and stuff, clean up your diet. It was on CNN, and it was Charles Barkley. Where was Anthony Fauci? I mean, seriously. So anyway, here's the data. It turns out that COVID-19, that dysfunctional immune response, everybody's heard the word cytokine storm, is generated by the microbiome. If you have inflammatory type of bacteria and you get COVID, you're going to be in trouble in terms of how sick you're going to get. So the GI microbiome determines how much inflammation you get. And so unfortunately, this data analysis from 6 countries came out, 16 months into the pandemic. And so that's still enough time. Most of us vegans knew this. We actually had, I know you know some of the people who say this, so I'm going to be gentle in saying it, but it was very clear within the first month that vegans were not dying of COVID. And so we had a bunch of vegans saying, don't get any vaccines. And I'm saying, no, that's exactly wrong. You're the person who would not know that you got the illness because you're vegan. And you'll give it to some kid, and who will then give it to their grandmother, and you'll never even know. And so please, get the vaccine just like everybody else. Just because it's not going to make a difference in you doesn't matter so much. Anyway, the data was very strong. What it showed is stunning, that all those keto people, that keto vegan war, it stopped after COVID because they were dying, as you can see, 48%, 50% higher rates of death if you were doing a keto diet, okay? Why? Because it's the microbiome. You eat animal products, you get a bad microbiome, you die of COVID. Whereas plant-based diet, and this isn't death, this is actually moderate to severe illness, 73% reduction. And I still haven't heard of a vegan diet. Somebody must have, but I haven't heard of it, of a vegan dying of COVID. Very strong data, should have been out there earlier and should be completely followed. And we would just happen to lose all of our cardiovascular mortality stuff if people did it for COVID. Okay, so what is the answer to all this? The answer is actually written already. I was one of the co-authors, actually. I did author section 3.1, if you want to see it, in the Prevention Guidelines 2019, American College of Cardiology, American Heart Association. And it turns out that we were focusing on all aspects of cardiovascular prevention. You might have heard that we added sleep after this document because sleep is so important for cardiovascular health. But what does the nutrition guidelines say? Vegetables, fruits, legumes, nuts, and whole grains. Oh gosh, and fish swam into my guidelines. It was a big fight. I lost. How? Why did I lose? Unlike the American College of Cardiology, American Heart Association is actually a stroke organization. And you saw them in a Mediterranean diet. It decreases stroke. So it got in my guidelines. Okay, but I put it in a different color. Okay, and I was very blue about that. Okay, so anyway, that's what people should be eating. Replacing all saturated fat, cholesterol, sodium, processed meat, excuse me, refined carbohydrates. I know, so those vegan beignets that I tease a lot of, the vegans are in different varieties. There's some religious vegans. Then there's the healthcare vegans. Then there's the planetary sustainability vegans. And then there are the animal rights vegans. So those last two groups tend to eat just about anything that didn't have a mother, right? And so they're doing the vegan beignets and the vegan donuts. And I know, I'm sorry, Ms. Williams, okay. The vegan pastry chef there, okay. And so I tease them a little bit. I say, it's really good for the planet because no greenhouse gases, no cows are harmed, and it gets rid of humans. Good thing. So anyway, getting rid of sweets and sweetened beverages, and that includes juices. Smoothies, good. Juice is not good. What's the difference? Fiber. It's exactly right, and it's fiber that changes your microbiome. Okay, and trans fat is not a problem in the United States anymore. Denmark, Canada, Sweden, and the United States all have banned public serving of trans fats. I'm glad of that. So how about any data where we could use those guidelines and intervene to stop our healthcare disparities? There's actually data. This is Adventist Health. It's actually older data, but it was very clear that if you take the African American population and even at late in life, change their diet, you're going to get dramatic drops in the amount of hypertension, diabetes, high cholesterol, and importantly, that bottom line, pesco-vegetarian, that is eating fish, did not change any of the risk factors. So very similar to, not what you hear, but very consistent with the literature. I think that one from Harvard saying that fish kills people more than red meat, I have a hard time believing that because of the microbiome stuff and the TMAO stuff, but I certainly wouldn't want to tell you that it's healthy. Okay. Here's a name you should know, Baxter Montgomery, African-American cardiologist, actually went from EP into nutrition, still does EP, but he focuses on health. Baxter Montgomery has a wellness center. You can send people to it. It's mostly African-American, not totally. And he does interventions, behavioral, dietary, has a restaurant, now has a farm, very serious. He actually did a really good serum analysis of all those risk factors, okay? So what would happen if you change them from soul food in the South, in Texas, to a whole food plant-based diet? And what you saw is dramatic improvement, okay? Now, it was a short-term thing, but it was very successful. So how about a longer-term intervention? So we actually did that at my place. This was the south side of Chicago, Obama's old church, and we published it in Nutrients, talking about 5 weeks of feeding people, sending them vegan food to eat for Lent. So I know we had a little advantage because people give up things for Lent, and they gave up eating regular food and just started eating what we delivered. And what we saw is all those risk factors, I'll show it to you graphically, dramatic improvement. The two on the left, 43%, that was insulin level and TMAO. Dramatic improvement in all of the risk factors, everything got better. And so we were able to calculate their risk. Does everybody have their ASCVD risk because Easter's coming up, you're going to be with your family. So there's an ASCVD risk. Please write that down and put it on your phone. Uncle Joe, what was your cholesterol last time? What was your blood pressure? How old are you now? You put it, and at the end of it, you will say, oh my gosh, 17.6% 10-year risk of heart attack, stroke, and death. Well, we actually did all the blood tests, did the risk ahead of time, saw what they were, and then after the 5 weeks, we saw a 19% decrease in that risk. Now, our mortality is only 21% higher, and we could have theoretically eliminated almost all of that with a 5-week vegan intervention. And so I'm hoping that we will get more of these. We're actually setting one. We got some funding to do this in Louisville. We have tools. This is from the Association of Black Cardiologists, if you want to take a picture of it or go online. It's a completely vegan cookbook by Baxter Montgomery and myself. And I want to switch over from the health equity for a few minutes to talk about our healthcare workers, because we are really struggling as physicians. The leading cause of death of cardiologists is heart disease, okay? Because we're not taught anything about nutrition, and we eat like the general public, unfortunately. I was kind of shocked. I thought we did a little better. Sarah Hull from a few weeks ago promoted this, saying that it's a moral imperative to change your diet if you're a physician, and be an example of how you can change the healthcare system by being healthy. So I was happy to see Sarah come out and be so bold, because I had this data, which still isn't published, but except in abstract form, and it was really bad. This was while I was at Rush, partnering with Loyola, did a survey of physicians, 274 physicians. How many of them 3 years later were following the ACC-AHA guidelines that I wrote? I always say, never get upset when doctors don't follow guidelines unless I wrote them. Well, as it turns out, it was 4%. Everybody else was eating something that they really shouldn't be eating. And the vast majority were eating an omnivorous diet. That's with processed meat and everything. So you start talking. You go everywhere you can, accept every invitation. I'm so glad to be here, to try and get people to do different. So I showed up to the American Society of Preventive Cardiology, and what were they feeding people? Gosh, really, really tough. So anyway, I really enjoyed being here, and hopefully I've stimulated. If you're vegan, great. If you're not vegan, hopefully you are now officially. But to summarize it, we went through heart disease, kidney disease, cerebrovascular disease. All of this is totally unnecessary. There are a few congenital things, but most of what I would say, when I went into Rush, there were 18 cardiologists. When I left to become chair of medicine, there were 53. If everybody was a vegan, I would need about 5. Electrophysiology doesn't go away, but the rest of it is totally unnecessary. Plant-based diets are associated with much lower risk of all of the risk factors that I've mentioned, and every disease that you see up there. And in this dual pandemic, it really is, I agree with Sarah Hall, a moral imperative for us to change our diet and to be as evidence-based as possible, not paying attention to commercial entities. All right, so I finished a little early. And so before opening up for questions, I do one more question, if I can put up with it. Okay, what's the mortality rate for eating beef? so had to throw that in there. So I'll stop here and open it up for questions. Thank you. Yes, ma'am. Ham, yes. So question is, what is considered processed red meat? It's ham, bacon, sausage, hot dogs, jerky, and I'm leaving off one, lunch meat. Oh, thank you. Yes, hi. Mm-hmm. So, Yeah, it's a sensitive thing for, and people hate when I start talking about myself, but I'm still playing tennis at a, hour a day or something like that, trying to, play national events. And I hate being that skinny vegan, okay, because I want to hit the ball harder. So it's really close to my heart. The idea is that you really should be doing at least 4 servings of beans, grains, nuts, and seeds per day. And then you're getting plenty of protein, no problem. So, I think you had a question. Mm-hmm.
So we saw all these benefits of plant-based diet.
Mm-hmm.
What is there any research that looked at like vegetarian diet
Yes.
with milk intake?
Yep.
So if it's no meat, all plant-based, but with milk, which is a dairy product, not
Yes.
taken in vegan diet?
Yes, so I would refer you to the Adventist Health study. It's a little difficult to dissect it out because, as you know, or you may know, the Adventists had been telling people, and I think they still may do, tell people from the pulpit that they should be an ovo-lacto-vegetarian. And so they're eating dairy and eggs. And it may be that the eggs are doing them in, but what you saw in the Harvard data, dairy does harm human health. So yes, so those would be the 2 data sets that would say that you really shouldn't be doing dairy. And of course, the cows would agree with me.
Okay. And so what about the kids? Like if you talk about the
Mm-hmm.
diets of the kids, which till a certain age, they consume milk. And so would you recommend being vegan from the get-go? Like,
So much to talk about there. Thank you. Okay, number 1, we're the only species that drinks the milk of another species. Nobody does that. Okay, that's number 1. Number 2, cow's milk specifically has 16 times the amount of growth hormone that human milk does. And so if you're going to do milk for a kid, it should be human milk. That's the way we were designed. As it turns out, they can talk about the induction of diabetes and leukemia and all the different things that people have attributed to milk, and the fact that we are genetically pre-programmed to lose lactase as time goes on, so it really should be eliminated from the diet. But if you look at the cholesterol and the saturated fat, it gets pretty simple that we really should be avoiding dairy products. So they're all really important scientific points. I know there's a lot of anti-dairy folks out there, and I was looking at the data and saying it's not so bad. The more data that comes out, the worse it looks. So. Yes, sir, Dean. That's me.
So thank you for incredible presentation and rapid fire data. I mean, it's just phenomenal. A big part of today's conversation was really around health behaviors. And, to one extent, you can look at what health behaviors have produced in terms of outcomes, but of course, many of us are really focused on health behaviors as in health behavior change. And
Yes.
what is it, how is it that we can motivate people, perhaps by data, but motivate people to make different choices and kind of move themselves in the direction of where ultimately we want everybody to be going?
Thank you for that question. So buried in that 5-week Lent intervention is one little paragraph about, everybody committed to follow up at 3 months and 6 months. It turns out, I came away from the trial questioning, I know I made a change, but did I make a difference? Because at 3 months and 6 months, about 1/3 of the people were really focusing on a plant-based diet, and they might have been exclusive, but they were pretty close. Another third had changed some, and another third we never heard from again, which means they took the food and they went back. So what you just asked, I think, is the most important thing we can do. We can present the science, but if we don't change behavior, if we don't have behavior modification tools in our tool belt, we're not gonna win this at all. And so this next time, we're going after it. We're going at the University of Louisville. We are actually partnering with the Traeger Institute, which has behavioral folks in it. And we are going to do everything that we can to change behavior We're going to talk to them ahead of time. We're going to give them the education. They will know why it is. They'll do the food intervention. This one is a crossover between Mediterranean and vegan. But still, we are going to make sure that we follow up with them, give them constant support. There are some places that have done a good job. Ornish's, you might have heard, Dean Ornish has a whole program. And people, it works so well. People say, well, maybe you don't even have to be vegan if you have a loving environment and social support and you stop smoking and you exercise. Maybe the vegan diet, and that's a tough criticism. It might be that diet, but he still believes it's the number one thing, but he does them all. And if you have this sort of camaraderie and social network and you get other people in your family to support you or join you, then you have some success. So that's my task. Thanks. Yes, ma'am.
So my question is somewhat similar to Dean Ball's in terms of, he asked a question about behavior. My question is about access. So you talked a lot about the Black community and how they're most disadvantaged here because of historically, the situation in terms of access to the right food. So we talk whole food, plant-based. Generally, that's not where the Black community can get to it. So is there any work being done to, understand what can we do to decrease that access challenge?
So thank you for that. So I covered a little bit, but I can go into a little bit more detail about President Biden. Got to give him credit. It was the first time in 50 years that the president had decided to do a food, hunger, health, and nutrition conference. And there were about 200 of us that were making recommendations. And, he actually went up to the podium and POTUS actually said all the things that I was saying, except for the changing the food commercials. He didn't go with that one. But buried in there, number one was education. That is, if people, and food labeling, okay? So if you put a red label on all processed meat and put, dairy as yellow and whole food plant-based stuff as green, it will change behavior, even in our community. It did it in France, Austria, and Australia. It's been proven. And he says they're going to try to do that. The FDA has wanted to do that for a long time. So let's go for it. So my food dessert versus desert, that whole idea is that the stores were going to populate what's not going to rot on their shelves. And so we have to change us if we want to change what's available in our stores. I hope that's happening. Okay. All right. Thank you so much, everyone. Okay. Take care.